You're listening to Rise Above, a Rogers behavioral health podcast, where we sit down with Rogers experts who are changing the way the world views mental health and addiction.
In the last episode, I sat down with Signa Myers, a leader at Rogers Behavioral Health. She was talking about the future of therapy, future of mental health treatment, and what that looks like at Rogers. And one of the things she brought up that we talked about a lot was called telehealth, which is basically therapy or mental health treatment through your computer. It's not Zoom, but it's a Zoom-like program where you speak face-to-face with a therapist, but you haven't left your home. You can do it on your computer, you can do it on your phone, and it seems like a very convenient option. Of course, with anything like this, questions arise. She answered a lot of them, but I also have some others that I think could best be answered by someone who's gone through the program. So today I've got someone who's gone through the program, and her name is Jill. Jill, thank you so much for joining me today.
Thanks so much for having me. I'm glad to be here.
So right off the bat, let's start with what led up to you seeking treatment at Rogers.
Sure. I didn't realize I had OCD and was dealing with significant increased what I just thought was generalized anxiety disorder, and come to find out there was a lot more to it. And so the provider I was working with recommended that I seek treatment at Rogers because I needed to step up and increase the treatment level I was receiving, and she was unable to provide that. So I reached out to Rogers summer 2020.
And so there you go, 2020. So it was right in the pandemic and right when Rogers was starting telehealth.
It was, in fact, when I called to schedule an intake call and had no idea what next steps were and was in quite a frenzy already, I assumed I would be going in person just because I didn't even know that telehealth was an option. So it was really interesting to learn that Rogers had just started that, which made sense because of we were at the beginning of a pandemic.
Right. So, okay. So then what were your thoughts when you found out that that's how you were going to be getting treatment?
So it was twofold, but mostly it was, oh, thank goodness, I don't have to leave my home and go somewhere. There's kind of a lot going on right now in terms of the state of the world and COVID restrictions and safety and all those things. So honestly, it was a bit of a relief in that particular context. Um, and I know that changes a bit post-vaccine times, but I was of the other mindset that was, how is this going to work? How am I going to receive effective treatment through a computer screen? And so both of those were running through my mind, but I was pretty open to just about anything at that point because of how far I'd spiraled with my mental health negatively.
Yeah. And I was going to say, like, questions. I'm sure you had tons of questions at the time.
Yes.
Number one,
I
how is this going to work?
Yes, number one, how is this going to work? Number two, is my laptop new enough for this? Number three, um, just how how do we connect every day? What does conversation look like? How do we know to get in touch? There were plenty of questions.
And then just on that, how do we connect? Like, how did you connect with your therapist? I mean, you're face to face, but over a screen. Did you have trouble making a connection with them?
I found it surprisingly easier than I would have thought to feel that I was having an actual conversation with an actual human being, even though we were not in the same room. I couldn't see their full body language. They couldn't see my full body language, etc. Um, but yes, I was surprised that we were able to connect in that way, in a useful and effective way from a therapeutic standpoint.
So looking back on your time in the program, did you have any doubts going into it? And when did your doubts start going away?
It's a great question. I feel like I definitely had doubts going in, but at the same time, just because of the nature of telehealth and it was new and I didn't know what I was getting into, and there was a global pandemic happening. And on the flip side, I was kind of hopeful about it because of said global pandemic. and having an opportunity to still participate in something that I know I needed, which was assistance and support with my declining mental health, rapidly declining mental health. So instead of having to concern myself with, oh my gosh, how am I going to get there and avoid people and deal with masks and no vaccine and all these things, I could, from the comfort of my own home, hop on my computer and talk to a therapeutic team. And I think some folks would say, well, how do you actually connect with someone via screen instead of in person? And that third wall is there, and you can't see folks in person and feel what they're feeling and allow them to feel and see what you're feeling. But I think that it was quite a benefit, pandemic or not. In fact, now, 4 years later, with vaccines and moving about the world to some degree as we used to, I still utilize telehealth services outside of Rogers. And there are folks I work with that I've never met, and I still benefit from the services that they're providing me. So I think at Rogers, I knew things were kind of working when I was moving through treatment and seeing results, and also seeing that honestly so much time and gas was being saved not having to go to and from treatment every day. It's amazing. I think telehealth really is a benefit, especially also I'll say for folks who cannot transport themselves as easily or would have to, take the bus and plan on how to get to and from and plan lunches or whatever the case may be, especially if you're a parent trying to get your child or someone who doesn't drive to treatment. That's one of the more, maybe not therapeutic, but kind of lifestyle based, I think, benefits of telehealth.
So I guess right on that note, what would you tell other people that are considering it or maybe are concerned about going into telehealth versus in-person therapy?
I would say that there's no harm in trying it because it might work really well for you and you might see some of those benefits. Just being able to hop on your computer or your phone at the drop of a hat from wherever you are versus having to travel and deal with traffic or whatever the case may be. Particularly if you're going to be in a program that is multiple hours a day, multiple days a week. And if it's not working for you, that's okay. It's certainly not for everyone. And fortunately, Rogers has in-person services as well. And it's not that one is going away. It's just that there are options. So I think it is completely worth trying from my experience. Whether you understand what you need or not, they are able to get you started. And perhaps you're starting at a lower level of treatment, and maybe that all you need is a telehealth appointment or two starting out. Just because that's where you start doesn't mean that they don't have other levels of care that they can support you in reaching or utilizing. So you may find yourself in need of more significant support, in which case they have more intensive programs, both via telehealth and in person, or in person, just based on your needs and what challenges you're trying to overcome.
Well, Jill, thank you so much for taking the time to talk with me today.
You are so welcome. I'm really glad I could be here, and I hope folks decide to reach out to Rogers. I'm really, really grateful that I did, and it's truly benefited me over the past 4 years since I originally started.
Thanks for listening to Rise Above, a podcast from Rogers Behavioral Health. Be sure to like and subscribe to be notified of new episodes. As always, if you or someone you care about is struggling with a mental health or substance use disorder, visit rogersbh.org for a free mental health screening.